As Canada continues to reopen, cases of COVID-19 keep climbing around the world. Since mid-June, cases have now doubled, showing the pandemic is gaining momentum. The World Health Organization has also pointed to political leadership as key to getting through this.
Almost 16 million cases have now been reported to WHO, and more than 640,000 deaths. And the pandemic continues to accelerate. In the past 6 weeks, the total number of cases has roughly doubled. COVID-19 has changed our world. It has brought people, communities, and nations together and driven them apart.
And there you have it from the head of the WHO. For more on this, Colin Furness is my guest, infection control epidemiologist. Hey, Colin.
Good afternoon.
So that surge, double in the last couple of weeks here. What do you make of it?
I kind of feel it was inevitable. This virus is really pernicious because of its ability to spread asymptomatically. The medical establishment hasn't wrapped its head around that globally. Politicians haven't wrapped their head around that, and neither have citizens. So this thing can spread so invisibly, I'm really not sure how it could have unfolded any other way.
I'm also curious, when we look at these global cases, Colin, that are at record levels, many of them in places like Latin America and Asia, countries that never really got a grip on the virus, like Brazil and Mexico and India. What do you make of those countries being so hard hit?
Well, there's a few what I call risk factors for countries, and there's a few protective factors for countries. Risk factors include not trusting your government. We've seen that in the U.S. and even northern Italy. There's risk factors when you have a lot of poverty, and we will see that in Latin America and elsewhere. Risk factors when you don't have strong public health infrastructure. Risk factors when you have people who are culturally used to living in close quarters and multi-generational living. So those are all risk factors, and where you see those risk factors, you see a lot of COVID. There's a few protective factors, the opposite of some of the things I mentioned, like trusting government and living in low-density settings. Scandinavia comes to mind. Canada, to some extent, comes to mind. And I think we can see really clearly the differences based on those factors.
I want to give you some specific examples of places around the world that are getting a lot of attention, that we're doing really well. And I know you're looking at them as well, Colin. Places like Australia and Japan and Hong Kong, where in the case of the Australians, the city of Melbourne now back in lockdown because they've seen hundreds of cases. Australia did really well. Japan as well, arguably, Hong Kong, but now this.
Well, Melbourne is to the southern hemisphere as we are to the northern hemisphere. They're far away from the equator, and it's flu season down there. So that would be one good reason why that's the case. For many countries, what's happened is that they've decided that travel is okay, and that's baffling to me. COVID moved around the world through travel. It arrived on airplanes, and countries that have decided that they're going to allow a lot of travel have essentially invited this, and it's very dismaying to see.
What about the United States, too? Because we are seeing states there record daily case numbers.
So the States has almost every risk factor going, all the ones that I mentioned, and it has it in spades. Although it's the wealthiest country in the world with the most advanced medical system in the world, that's only available to a certain slice of the population. There's a lot there, a lot of people there who don't have access, who don't have good nutrition, do not have access to health care. There's very little public health infrastructure for those folks. And that is the results, therefore, end up being kind of predictable. The leadership and the divisiveness and the communication confusion around masks and no masks have obviously made it worse. But I did see that coming in late March. I said that we haven't hit my prediction yet, but I said that we were going to have a loss of life in the U.S. that exceeded World War II, and I think we're on track to get there.
Back here in Canada, I want to get your read on this story. It's getting a lot of headlines in Ontario, and what I appreciate about you is that, you'll often tell it like it is. So here's the situation in Brampton. You know where I'm going. Somebody hosts a party, 200 people or so show up. They've got fences around the location to try and, I suppose, cover it up. Who knows? There's security as well, and this kind of thing goes on. The Premier of Ontario saying this is completely unacceptable. And by the way, there are other parties, too, in that area, at least 2 others, that are getting a lot of attention and concern. Your read on what we saw in Brampton.
Well, there's something about being in your 20s that makes you feel invincible. I think I used to feel that way. And honestly, if I were in my 20s for COVID, I could see myself very easily coming up with a narrative where it's okay for me, it doesn't matter for me, I'm going to be fine, I'm not going to hurt anyone, I'm a good guy. I could see myself doing that. And so folks in their 20s, I think, have that vulnerability, actually, which is really what it is. They've been hit really hard socially, harder than a lot of other age groups, I think, from the lockdown and from physical distancing. And so this is bound to happen. I would love to have a clear message for that group that says, let's just do it outside, and let's do it outside in a smart way with some physical distancing. I'm happy seeing drinking in parks. There's all sorts of behaviors we normally don't like to see that I think would be great. So rather than wag our fingers and say you can't party, let's find ways to do that more safely. As for this particular one, I would like to see charges against the folks who organized it. I think that would be a useful thing to do as well.
There's discussion of a $100,000 fine as well. And, people are trying to figure out, how do we get the message across here? How do we make this tough enough so people stop doing this kind of thing? What do you make of that $100,000 potentially?
Well, that's a fine that's so big it may never even get levied, or if it gets levied, the folks on the receiving end may not be able to pay it. I'm not sure the giantness of the fine is actually going to move the needle. I think actually messaging really clearly to everyone in Ontario, talk to 20-somethings in your life, talk to them and find out. I've been doing that, and actually what I've discovered is the ones in my orbit, which include students of mine, are actually exceedingly cautious. So this does not apply to everyone. It is only a certain slice of that demographic doing that. But if everyone talked to a 20-something and said, I'm scared, that could have some impact.
Colin, good to have you back today. Thank you.
My pleasure.